Hi, David.
Hi, Eric.
How are you doing?
Very well, thank you. Good to see you.
And good to see you as well, David. Look, first of all, big thank you for taking the time out today of your busy clinical practice. I know that at Total Foot Health, you've seen a lot of people there, so I really appreciate you taking the time out today. And today we're going to be speaking about Morton's Neuroma, which is a common foot pain problem that people have.
Yeah,
But before we get into that, for people that don't know you or Total Foot Health, maybe just share a little bit about yourself and Total Foot Health, please.
thank you. We are a podiatry clinic based in Salisbury. Been here for over 10 years now, and we have a large team of 4 podiatrists, 2 foot health practitioners, and a rehab therapist. And we have a range of technologies such as video gait analysis to help with looking at how people walk, and we have an ultrasound scanner that helps us look inside somebody's foot to try and work out what's going on.
Yeah, fantastic. So you truly do offer a total foot health care clinical experience when people come to see you, which is fantastic.
Absolutely. Yeah.
So look, before we get into speaking about Morton's Neuroma, just want to make it clear to people watching this conversation we're having, this is not for diagnosis purposes or treatment. In order to have a proper assessment and treatment plan, they would need to see a podiatrist like yourself face to face for that.
Absolutely.
So just to make that clear. So Morton's Neuroma then, a common foot problem. I know my clients, 1 or 2 have suffered with this in the past. Can you share with us what are some of the common symptoms and maybe some of the less common symptoms that people exhibit with Morton's Neuroma?
Well, it can be a range of symptoms. Symptoms are usually intermittent. They can just come and go through the day. Classically, it can be an aching, burning or stabbing, or a feeling of walking on a pebble. Normally in the ball of the foot, but can radiate into the toes, and people might experience sort of funny nerve-like sensations of tingling or numbness. Sometimes a feeling like the sock is wrinkled inside the shoe, and often it'll be aggravated after a period of time wearing a tighter fitting shoe, or after activity like walking or running. People will become aware that there's something going on in the foot.
Yeah, and in the worst cases, are people pretty much incapacitated to not being able to walk? Are they having to sort of stop and sit down? And
usually, most people will become aware that there's something going on in the foot, and it's often relieved by taking off the shoe. But yeah, in some cases, the symptoms progressively worsen over months or even years. And yeah, sometimes it can reach a point where people literally are stopped in their tracks, and they have to remove the shoe, and they can't carry on until the pain's disappeared.
Sure. And you mentioned there that some people may suffer with this for years. So some people leave this untreated, undiagnosed for that length of time.
Yeah, some people, like I say, it's just some minor symptoms that just come on with certain activities, and it quickly goes when they take their shoes off, so they learn to live with it. And other people, it's been developing for some time, but it's never really bothered them, and then all of a sudden, it's causing them problems.
Okay, so those are some of the, let's say, some of the classic symptoms. What would be some of the causes then of Morton's neuroma, potential causes of Morton's neuroma?
So it's really a compression around the nerve between the toes. So conditions within the foot, such as a bunion or a hallux valgus that makes the foot a bit broader, or wearing footwear that's a bit too tight, maybe a bit too flimsy. And then people that generally do a lot of walking, so keen walkers and people who enjoy running, that sort of repeated activity over many years can contribute to the problem.
And you mentioned there a technical term, hallux valgus. Can you just maybe make that into sort of lay terms for the listeners, please?
Yeah, so that's the medical term for a bunion, where there's a prominence around the big toe joint.
Yeah.
Hard lump, or where the big toe is pushing over into the second toe.
I see. So those are some of the causes. So some of the symptoms, some of the causes of Morton's neuroma. What are, and again, on the back of an assessment, what have been some of the treatments that have been administered to help relieve Mortons neuroma?
Yeah, so as you said, following an assessment and diagnosis of a podiatrist, would normally recommend footwear advice. It is usually enough for most people to manage the problem.
Sure.
But in those cases where a patient's coming in and it's just causing them problems and they've tried the simple stuff, then we may recommend therapies such as custom-made foot orthoses, or to wear in their shoes, or an injection such as corticosteroid can be helpful to take away any pain or inflammation. And in some cases, if the problem keeps causing issues, then we may refer the patient to a podiatric surgeon, a specialist who can look at the foot problem and potentially remove the section of nerve causing the problem.
Yeah. That's good. Look, and what I like about the way that Total Foot Health approach any foot problem is you really go from, you do your full-blown assessment, which is important. We've said that several times now. It's important you get a proper face-to-face assessment. But I like the way you go from this non-invasive advice, and you can take the patient right the way through, if necessary, to referring them for surgery if necessary. So it's a full experience, it's a full journey they're going through if necessary.
Yeah, always try to avoid anything too invasive where possible.
Yeah, brilliant. Look, David, once again, I really appreciate you taking the time out today of your busy schedule and your clinic. Thank you for sharing that information today on Mortons Neuroma. For people who would like to know more, or maybe are struggling with this particular condition, or think they're struggling with it, or any foot problem for that matter, how can they get more information about Total Foot Health, please?
They can go to our website, totalfoothealth.co.uk, and they can find out more information there about the range of services we offer, as well as our contact details, our phone and email address.
That's brilliant. David, once again, thank you very much for your time, and I'm sure we'll be speaking again in the not too distant future.
Thank you for having me.
Thank you.